Hi, this is Dr. Paul Wylie. I am the Medical Director of Preferred Research Partners, located in Little Rock, Arkansas, and also in Fayetteville, Arkansas. And today I want to talk with you and provide a little bit of educational information about two different mental health disorders. The first is social anxiety disorder, and the second would be generalized anxiety disorder. Social anxiety disorder is also known as social phobia, and lots of people have mild degrees of this problem. For example, I have a mild degree of this problem, so even though I'm here on camera talking with you, that situation doesn't bother me. But if you ask if I have social anxiety, if I have to give a lecture in front of 500 to 2,000 different people, that certainly gets me anxious. And so lots of people have this particular problem. And so I have empathetic understanding of people who might struggle with this to even a greater degree than what I've been affected by it. So about 90% of cases of social anxiety disorder start before the age of 23, and it can start as early as 9 years old. And social anxiety disorder is actually the third most common mental health disorder, affecting around 7 to 13% of the general U.S. population. And the symptoms of social anxiety can wax and wane in intensity over time. So I think it's important to recognize that this disorder can affect children, certainly affects preteens and teens, and gets its start early in life, but can manifest itself throughout the entirety of one's life. And there are a lot of famous people out there who have been affected by generalized anxiety disorder. So, for example, Kim Basinger, the famous actress, has talked about her struggles with social anxiety over time. People may be surprised that Donny Osmond has reported that he has some social anxiety disorder, despite the fact with thousands of performances in front of people. Barbra Streisand, the famous singer, has reportedly mentioned that she has social anxiety disorder. And more recently, within the sports community, tennis player Naomi Osaka has indicated that she had social anxiety disorder. So lots of folks are affected. So how would we define social anxiety disorder? Well, specifically, it's a condition where someone has a persistent, intense fear of various social situations where they could be, and certainly fear that they will be, scrutinized, embarrassed, humiliated, criticized, or judged by others. And this fear can be paralyzing and sometimes rise to the level of individuals having near panic attacks or actual panic attacks in response to being exposed to specific social situations. Individuals affected by social anxiety disorder often have excessive self-consciousness and embarrassment. They avoid eye contact at times in social situations, and they may feel like they are being watched. Individuals affected by social anxiety disorder may experience physical symptoms such as blushing, sweating, fast heartbeat, trembling, nausea, chest tightness, diarrhea, trouble urinating in public, and of course, as I mentioned earlier, difficulty with public speaking. People affected by social anxiety disorder are folks who may have trouble initiating or maintaining social interactions, particularly in a group setting. And so social invitations will be passed up or avoided, or any number of excuses will be made as to why someone cannot attend or participate. And those individuals affected by social anxiety disorder may find that they have difficulty making friends. And very interestingly, when they do rate friends, there's been some experiments shown that folks with social anxiety tend to rate the relationship with their friend as not being of high quality. And that's even if the friend reciprocally, independently, rates the relationship as being very good. Individuals with social anxiety disorder often experience avoidance, and avoidance is considered a major feature of this disorder, specifically avoidance of social situations such as dates, meeting strangers, going to parties, going to the mall, eating in restaurants, giving professional presentations, entering into a small group or large group conference room. And the anxiety, the fear, and the subsequent avoidance of social situations become considered to be a disorder when they cause someone to experience significant distress or impairment in their daily functioning or quality of life. Now, the exact cause of social anxiety disorder is not fully understood, and there's all sorts of theories, but those theories include things like family genetics, early childhood experiences, parental anxiety or over-control, but in particular, negative social interactions experiences at a young age could be such as being bullied or ridiculed, might contribute to development of the disorder. And some kids can develop a fear of making mistakes, fear of making people upset or of disappointing family members, and then that fear can just persist on into their adult life. And chemically speaking, social anxiety disorder is thought, at least in part, due to a overactive part of our brain called the amygdala. And that's the part of our brain that controls our fear response. And currently and for years, there are a variety of treatments for social anxiety that can include seeing a therapist for cognitive behavioral therapy. Katie Walker, the therapist that we featured in our last podcast, certainly can perform these treatments through her company, Indigo Health. She also can engage individuals in what's known as exposure therapy. And exposure therapy is where someone who has social anxiety and even other types of anxiety disorders are exposed in a gradually intensifying manner over the course of time to the circumstance that they develop the anxiety response to. And this helps then reduce the anxiety over time. So, for example, it could be, okay, we're going to go shopping in a grocery store today. And we're going to use the techniques I've been teaching you to help you cope with that situation and manage your anxiety while we're in there. There are medications to help control anxiety. Historically, serotonin-specific reuptake inhibitors have been helpful, but often not completely helpful. And we're back to the old problem with those medicines where in order for them to work, you have to take them every day. They aren't necessarily making the situation go away, and the response may only be partial. And then some people with social anxiety receive benefit from taking a medication called Inderall, which is a beta blocker, or other forms of beta blockers. And these medications help reduce the cardiovascular response to anxiety, so maybe not a shortness of breath, maybe not the fast heartbeat. And they can also reduce some of the peripheral response to anxiety, such as maybe no sweating or trembling. Some individuals with social anxiety disorder benefit from, during therapy, in engaging in what's called work coaching. For example, individuals with social anxiety often find that they may excel more in working with home-based job or employment opportunities for a period of time until they can manage it more effectively. Unfortunately, if left untreated, social anxiety disorder can lead to depression. It's been linked to increased use of substances, and certainly social anxiety can lead to impaired education and put some limits on career success. It's very interesting. There's research being informed while we're talking about the cause of social anxiety, where someone can be evaluated through use of what's called a functional MRI, where you look at brain metabolism. And so there's research out there where they'll have an individual affected watch a group of individuals look at their picture. And those individuals looking at their picture rate the picture as to whether they like or dislike the individual in the picture. And then while watching that, we see how someone's brain with social anxiety lights up metabolically in response to being rated. And then we try to see whether or not there might be a false memory problem. And a false memory problem would be a problem where positive feedback is not retained in the memory nearly as easily as negative feedback might be. So some people's brains, genetically and chemically, we're finding out, have a bias toward negativity that they recall much easier and much more strongly than positivity. And what's interesting is people can rate the picture. You can have all the people rate the picture as, oh, I really like this individual in the picture, but the people with social anxiety will not necessarily experience that in a positive way or recall it as being a positive review. So this is a disorder that can really significantly affect people, and I'm excited to talk about it today, help people understand what some of the features of the disorder are, because we have at Preferred Research Partners a clinical trial going on right now through a company called Vistagen. And we're helping test the effect of a very rapidly acting medication for treatment of social anxiety called fasedienol. And this medication is interesting in that it's a nose spray. So it's very rapidly absorbed through the nasal mucosa, goes up into the brain to the amygdala that we were talking about, and helps reduce the social anxiety response. And the medication is available through the clinical trial to actually use as much as 4 to 5 times a day. So someone could have a time where they might have a job interview with multiple people over the course of the day. They could use it on multiple occasions. They might have to give a couple lectures over the course of the day. Maybe in the morning they might have a job review for performance. And then in the evening, maybe they go to a concert and that makes them anxious being in that social situation. Or, for example, they might have to perform in front of their classmates at college. So that makes them anxious. And then that night they might need to go to dinner. It might be an important dinner for them socially or professionally, but the anxiety prevents them from doing so they can use the nose spray at that time. So we're very excited about helping Vistagen test this medication, and we're looking for individuals in the community who are affected by this disorder to kind of step up and help us test the medication. And I think you may find it to be of hopefully significant benefit to your quality of life. So that is social anxiety disorder. Now, there are lots of anxiety disorders, and some people have what we call mixed anxiety disorders, and that's where they have components of a variety of different problems. So, for example, they might have what's called agoraphobia, and that's a problem where individuals just don't leave home. And they may not leave home for months at a time, not to avoid social situations, but people with agoraphobia don't leave home because they don't feel safe in going to some situation from which they can't easily escape or control. And so they just avoid it. And so imagine the impairment that goes along with that. There's also obsessive compulsive disorder as an anxiety disorder where individuals are worried about and have obsessive thoughts or behaviors that often prevent them from proceeding on with their life. So, for example, I can't leave the home until I check the stove 5 times to make sure it's turned off. And then when I leave the home, I cannot step on cracks in the sidewalk until I get to my car. And if I do, I have to start over again. And by the time I do that, I'm late for work. And so some individuals have that particular problem, or they may be very obsessed with cleanliness or hygiene. But there's another type of disorder that is very prominent in the community. In fact, while I mentioned that social anxiety was the 3rd most common mental health disorder, I want to talk now about generalized anxiety disorder, which is the 2nd most common mental health problem behind depression that individuals can have. So generalized anxiety disorder occurs in someone who experiences excessive, ongoing, persistent, unrelenting, and uncontrollable worry and anxiety about a wide variety of everyday events and situations, not just social situations. And this worry and anxiety that they experience interferes with multiple different aspects of their daily functioning. So folks with social anxiety can be perfectly fine throughout the entirety of the day unless they're exposed to some triggering social situation. Individuals with generalized anxiety disorder are not necessarily perfectly fine throughout the day. Their worry and anxiety can interfere with multiple different aspects of their daily functioning, and that worry and anxiety is just out of proportion to the impact of the events or the situations that might come up. So, for example, people with generalized anxiety disorder may worry excessively about their health. They may worry about their relationships, their finances, their family, their friends, their work, etc. And these worries occur even though there may be no problems in any of these areas for this individual. And, everybody worries about some of these things occasionally, but the difference is when you have generalized anxiety disorder is that you worry about these things all day, every day, for at least 6 months, often even without there being a hint of a significant problem in any of these areas. This type of worry is often called anticipatory anxiety. And people with generalized anxiety experience physical symptoms. For example, they can have motor restlessness, fatigue, trouble concentrating, muscle tension, feeling keyed up, irritability, headaches, stomach or bowel problems, as well as sleep disturbances. People with generalized anxiety disorder are often cognitively effective because they engage in this anticipatory overthinking about the possible, generally worst-case outcomes to any situations, and continuously thinking about plans and solutions for those situations that aren't necessarily even present then and may not ever become present in the future, and then have an inability to not think about those situations. And again, whether it's involved with their health, their work, their personal life, their family, friends, once again, even if there's nothing wrong in those particular areas. Individuals with generalized anxiety are often affected by indecisiveness. They have a fear of making a wrong decision, often resulting in there being no decision and there being marked procrastination, which then causes a problem in one's personal and professional life. But paradoxically, individuals with generalized anxiety often struggle, though, with uncertainty, with handling uncertainty in things going on outside themselves or in handling uncertainty from other people. When someone has generalized anxiety disorder, events or situations may be perceived as threatening, even when they're not. And folks with generalized anxiety disorder can have social anxiety mixed in along with OCD traits and maybe panic symptoms. And so as a result, people with generalized anxiety disorder also have some of the avoidance features that are shared with social anxiety. People with generalized anxiety often have anxiety for no apparent reason. Specifically, again, for example, worrying about the safety of a loved one, or harboring a general sense that something bad is going to happen in the future, even though there's absolutely no indication that their loved one is under any sort of threat or at any sort of risk, or that there's any indication that something negative is going to happen in the future. People with generalized anxiety disorder may be and often are perfectionists and generally worry about their performance, or they may worry about impending natural disasters, even though there's no indication that their performance is not excellent. After all, they tend to be perfectionists. And there's no indication that any sort of natural disaster is imminent. So some of the treatments I mentioned before for social anxiety will also apply to individuals with generalized anxiety, various forms of therapy, various forms of medication. But once again, the medication that's currently available out there has to be taken every day, often incompletely effective, and leaves people wanting access to something better to help their quality of life. And so I'm pleased to report that Preferred Research Partners is working with a company called MindMed, and we're currently testing the impact of a single dose of MindMed's psychedelic medication. And early studies, we've already done one study with MindMed for generalized anxiety disorder, indicated that the medication produces a almost immediate, in less than 24 hours response and improvement in the anxiety. And in at least 4 out of 6 people who were treated in that study, they've had so far no relapse on their anxiety over the course of an entire year. So one dose of this medication, and you don't have to take medication generally going forward. Now, we had one individual that was in the previous MindMed trial, Katie, she mentioned before, went back on some anxiety medicine at low dose, but it's completely effective for her at this time. And last time, Katie, of course, mentioned that if she had the opportunity to redose with MindMed's medication, she certainly would. And hopefully that medication will be commercially available in the future. We had one person develop depression as well. That was in the anxiety study. But the other folks are still all doing great with their anxiety. So I hope you have enjoyed this educational presentation today and that you have learned about social anxiety disorder and generalized anxiety disorder and what the differences are between them, and that you will consider with the information the possibility of either yourself, if you're affected, or friends or family members or coworkers participating in one of the clinical trials that Preferred Research Partners has going on right now to test treatment for these two different mental health disorders. And if you have an interest in participating, or again, friends, family members, contacts, etc., please contact Preferred Research Partners at www.preferredresearchpartners.com, or our phone number is 501-553-9987. We look forward to hearing from you, and we hope we can get you involved in a clinical trial to be of help to you. But also, part of engaging in clinical trials is to realize that you're doing something that's going to be for the benefit of individuals who also are affected elsewhere in the community, and helping improve the lives of folks in the future. So with that, I thank you for your time today, and hope you enjoyed the educational presentation. Thank you.